you know, I think I recognize in myself and in my own journey that trauma had a huge role. And I'm hoping that sharing it will help more of you feel comfortable in sharing that experience, or even just being aware of it and then starting to address it. What I want to talk about is I am not a licensed psychiatric professional. I am a medical doctor and a functional medicine physician. I do have a program called Transform Autoimmune Disease, where a huge part of our program focuses on mindset. What is the role of thoughts that you think and the impact it has upon your health? I know that surprises a lot of you because we talk about the 5 pillars of our program. And honestly, it really should be like 5 pillars and 1 giant pillar, or it should be if you actually look at the model of our program, the 5 pillars, at the circles around it, it's called a seed of life model, where the life seed of it all, the force of it is in the middle of the triangle of the geometry. And the shape of the seed of life model is sacred geometry. And that seed of life in the middle, for me, really is mindset and where your emotional and spiritual seed is. And so that's why I'm talking about trauma today, because it's had an indelible mark on me and my own understanding of my diseases or disease state and my own recovery. I'm sharing this not for voyeuristic reasons or to purge anything, but I want to say that what's really important is that this is why when you look at Transform Autoimmune, our program Transform Autoimmune, a huge part of it is mindset work. And I don't talk about it as much because I think most people expect a medical doctor with a program around autoimmune disease to be talking about just medical components. But I feel like I'm really doing disservice when I don't highlight that it's absolutely a mindset program to change how you think and these thought patterns that are extremely destructive. One of the things I've really learned a lot is when I'm dealing with, is to even notice the awareness. There I am shutting down. I notice now pain at level 1 and 2. I didn't notice it before. I notice it now. So this increased awareness has been incredible because you get to intervene earlier and earlier in pathology of your body when you have awareness. So most importantly in this video, I want to point out that awareness is really important, and I want to raise the question and I want to raise the bar of your awareness of the role of trauma and how important it plays out and why for me it's also mindset work is a crucial piece, changing those thought patterns, being aware of it and interrupting it and changing it is how you're going to get different results and different outcomes. And that is just to give you an idea what some of the mindset work that we do in the program is, why we do mindset and why I say it's a big mindset program. Even though it's not something, I think it's kind of hard conceptually for a lot of people to be like, why do I need a mindset program for my autoimmune disease or for my hormones or for anything else? And I just want to share this experience to show you guys how important it is to actually change how you think. Me being aware that I was scared or subconsciously not allowing my neck to turn fully to the left and right caused me to nearly die in several other car accidents. And that's a very physical example. But think about being limited emotionally or physically, where you completely shut down to your pain symptoms or you completely shut people out. How much of the traumatic effect would that be downstream on everything, your relationships, your health, your finances, everything. So I hope that was helpful for you guys to understand that, I think I recognize in myself and in my own journey that trauma had a huge role. And I'm hoping that sharing it will help more of you feel comfortable in sharing that experience, or even just being aware of it and then starting to address it. Tim Ferriss actually recently did a podcast about trauma, and he has a really great webpage around trauma. If you want to check out Tim Ferriss's podcast around trauma in his life, as well as trauma resources. At some point, I think I'm going to do a full-length podcast, so I have more time and more depth to actually discuss more specifics and more things I did to really turn around my trauma and build a resource page around trauma recovery, because absolutely it's possible. If you guys are interested in me doing a full podcast or going a deeper dive, I would love for you to comment in this comment section below, deeper dive, or you can write podcast. And I will make that happen, as well as if you're interested in a trauma resource page, I'll see what I can do with that, all right? So interestingly, viruses and infection can absolutely also play a role in changing brain neurotransmitters and even thought patterns, actually. There's a whole role of gut bacteria in brain neurotransmitters and brain health. So yes, there's a lot of connections. This is a very deep, hugely packed. This is why we have the whole program, Transform Autoimmune, around all these pieces and how they tie together. These are really good notices. Amy says, I grew up in a home with a drug addict that made life a living hell. Yeah. Addiction is a really, really huge trauma, provoking to have a family member with that. To experience it yourself is very traumatic on your body and on yourself and everyone around you. So yep, I'm hearing addiction and addiction over and over again. And incidentally, there's a much higher rate of addiction in people with chronic disease and autoimmunity. And there's multiple reasons for that. If you guys are ever interested, if any of you are interested in learning more about what's the role of addiction and autoimmunity or disease, put it in the comments section. It is a topic I'm open to discussing. I had a practice and I'm currently working in addiction medicine as well. So it is something that I could absolutely speak more on if you guys are interested in talking more about addiction and autoimmunity or chronic disease. All right. Thanks, everybody. Okay, that's really awesome. Thanks for all the engagement. And I hope you guys enjoyed this Autoimmune Table Talk. If you enjoyed it and you feel like someone could benefit from it, in about a week, this is going to be posted. You guys in the Facebook group get first dibs. Everybody else, we're going to be posting this to the Facebook page in about a week, Instagram and YouTube. Once it goes live in those public pages, you can tag and comment someone in the comment section below. And they may not listen to you, but they may listen to me. So sharing is caring. So thanks for raising awareness. Those of you that are watching that it's not part of our Facebook group, make sure you join our Facebook group, Transform Autoimmune Disease Naturally. All right, everybody, thanks.